Hello and welcome. You are watching Step Up Medicine's series on cardiovascular physiology. In this episode, we'll break down the relationship between pressure, flow, and resistance, explain how blood moves through the circulation, and show you how small changes in vessel diameter can have a huge impact on blood pressure. By the end of this episode, you should be able to define the relationships between blood flow, pressure, and resistance. Apply Ohm's law to the cardiovascular system. Understand factors affecting resistance, including vessel diameter and viscosity. Recognize the physiological differences between series and parallel circuits.
Let's start with a formula you might recognize from physics: Ohm's law. In electricity, Ohm's law is V equals I times R. In cardiovascular physiology, we use a similar equation. Flow equals pressure difference divided by resistance, or in symbols, Q equals delta P divided by R, where Q is blood flow, or cardiac output. Delta P is the pressure difference between arteries and veins. R is the resistance to flow, mostly determined by arterioles. This means that if resistance goes up, pressure has to go up too, assuming flow stays constant. That's why vasoconstriction raises blood pressure, and why understanding resistance is essential to understanding circulation. Now let's go deeper and look at what determines resistance. According to Poiseuille's law, resistance is affected by three main factors: the viscosity of the blood, the length of the vessel, and most importantly, the radius of the vessel. The full equation is resistance equals 8 times viscosity times length, divided by pi times radius to the fourth power. Or more simply, R is proportional to 1 divided by radius to the fourth. This means that even a small decrease in radius dramatically increases resistance. For example, if a vessel's radius is cut in half, the resistance increases by 16 times. That's why arterioles, which can change diameter easily, play such a major role in regulating blood pressure.
Next, let's talk about how blood vessels are arranged. Vessels can be connected in series or in parallel. In a series circuit, blood flows through one vessel, then the next, and so on, like going through a hallway with multiple doors. The total resistance in series is the sum of all individual resistances. So, the more segments, the greater the resistance. In a parallel circuit, blood can flow through multiple vessels or organs at the same time, like taking different lanes on a highway. In this setup, total resistance is lower because flow is divided among pathways. That's how organs like the brain, kidneys, and muscles receive blood simultaneously. And during exercise, opening more parallel circuits to active muscles can actually decrease total resistance, even though blood flow increases.
Let's see how these principles apply in clinical scenarios. In vasoconstriction, the radius of blood vessels decreases. This increases resistance and raises blood pressure. Nananon polteri ikis ini salom hay. In anemia, blood viscosity is reduced. That lowers resistance and may increase flow, even when oxygen carrying capacity is low. In atherosclerosis, blood vessels become narrower due to plaque buildup. This decreases radius and increases resistance, making the heart work harder. In septic shock, blood vessels dilate throughout the body. This causes a massive drop in resistance and leads to dangerously low blood pressure. These changes affect how hard the heart must work, how well organs are perfused, and whether the body can maintain stable circulation.
Let's go over the key points from this episode. First, flow equals pressure difference divided by resistance. This simple relationship helps explain how pressure, flow, and resistance interact in the cardiovascular system. Second, small changes in vessel radius have a huge impact on resistance. Because resistance is related to radius raised to the fourth power, even a minor narrowing can significantly raise resistance and pressure. Third, arterioles are the major resistance vessels. They play a critical role in adjusting blood pressure and directing blood flow to different organs. Fourth, series circuits increase total resistance, while parallel circuits reduce it. The body uses parallel flow to distribute blood efficiently and reduce strain on the heart. Finally, clinical conditions like hypertension, anemia, atherosclerosis, and shock all involve changes in resistance, pressure, or flow, and understanding these relationships is essential for diagnosing and managing cardiovascular problems. Now test your knowledge with this quick question. According to Poiseuille's law, what happens to vascular resistance if the radius of a blood vessel is reduced by half? A. Resistance doubles. B. Resistance triples. C. Resistance increases 8-fold. D. Resistance increases 16-fold. Leave your answers in the comments below. If this helped clarify your basics, like and subscribe for more high-yield videos. Up next, we will be taking a closer look at compliance, capacitance, and the arterial system. Thanks for watching, and keep stepping up your knowledge.